Hi, everybody. We're just waiting for all our participants to sign in, and then we'll get started in a minute or so. Got a few people that have joined on. We got about another minute to go here. All right, we are about noon sharp, so we'll get started. My name is Casey Sowinski. I'm a physical therapist for Renew Physical Therapy in Freeland. I've been the managing partner out there for about 11 years now. I have worked in some of the other Renew clinics in the Great Lakes Bay region, dealing mainly with orthopedic injuries. So this webinar is about how to safely strengthen your rotator cuff muscles. It's a big problem that we see and that I see a lot in practice, and I think it's a good topic to cover, kind of give you some tips on how to prevent further injury or ending up in my office, hopefully. These are general exercises that I've put together, may not benefit everyone. If you do have symptoms of a rotator cuff injury, you should definitely seek medical attention. Possibly physical therapy might be involved for you. And then we do have a way to submit questions during this webinar. I think there's a Q&A button you can click on and then type them in, and then we'll answer some of those at the end. All right. So what is a rotator cuff? And it is cuff, not cup. I've had people say that numerous times in the clinic. It is a cuff muscle. These are the four muscles you can see in this picture, and I also brought a little model to show everybody. But this is your shoulder joint. This is the head of the humerus right up in here. This is the humerus bone, so the long bone along your arm here. This other structure is your shoulder blade or your scapula, kind of rests on the back here. And that's where all the muscles kind of start, and then they attach into that head of the humerus. Okay? And what their main function is to keep that bone in the socket of the shoulder when you're doing any movements. It's a very kind of unstable joint, the shoulder, and this is one of the main stabilizing forces, along with some connective tissue, ligaments and stuff that surround it. But if you have issues with your rotator cuff, that shoulder starts riding up and getting pinched under your collarbone and can cause some inflammation and issues for us. All right. There we go. Okay, so rotator cuff injuries. This is a cause of about 2 million visits to the doctor each year in the United States. So it can range from just some inflammation of the tendons to a partial tear, possibly even a massive tear in the tendon. Very common again, and it tends to become more common as you get older. There's a different degree of tear that we can have in this. In this picture, this is kind of what we're looking at here, is this partial tear. It can, and usually when we grade the degree of tear, it's how deep up and down the tear goes, not necessarily how long. There's a different way we reference that. So when they say a partial tear, it means it doesn't go all the way through the muscle and tendon. It's just partially through. Complete tear would be all the way through. A complete rupture, this whole structure rips off the bone. Then we got big issues. Okay, so where do we typically find these injuries? Usually in jobs with heavy lifting or if you have to reach overhead quite a bit. I tend to think of a lot of our trade jobs, like a welder, pipe fitter, where you're having to do heavy lifting, maybe working overhead in a cramped space. That's tends to be any job could contribute, could cause this. Hairdressing, you're using your arms a lot for long hours. So anything where it's repetitive task. Also can occur with a traumatic injury, such as a fall onto your arm. My mom has torn her rotator cuff twice, and both times with traumatic fall. Fell dancing with one of her elderly aunts one time, and also fell off her bike on her arm. So both times she had to have a repair done. It's kind of how I got introduced to rotator cuff tears. Diagnosis for these is usually done with an MRI imaging, possibly CT scan if you can't have an MRI. That'll determine your type of tear or if it's just inflammation going on. Another thing I wanted to mention was a study I found in doing a little research for this. And I think there was like 600 and some participants, and they did some imaging to kind of look at rotator cuffs. So these aren't people that necessarily were having symptoms. And then they found about 21% of them actually had like a tear in the rotator cuff, of which 2/3 were asymptomatic. So they didn't even have any symptoms, even though they did have a tear present. Okay. Symptoms of a rotator cuff injury. Usually you'll have a deep ache in the shoulder joint. You will have difficulty sleeping on that side, usually, of the injury. Reaching overhead is usually limited. That's kind of one of the tests we'll look for when you come in. Also, reaching behind the back. I think of someone has a bra that they have to fasten. They have a real difficult time reaching back there, and they'll have to do the little spin around method. And then you can also just have some weakness. You might not be able to lift the plate up into the cupboard anymore. And then we also have those people that are asymptomatic. And again, it can be asymptomatic because it's not much of a tear, just maybe those partial ones we talked about. But you also might have developed some good strength, maybe doing some of these exercises I'm going to present on, and you've built it up enough where your shoulder can kind of overcome that injury. I have a 90-year-old patient who was a bricklayer, and I'm pretty sure he's got some tears in that rotator cuff, but he has full functional mobility, and his neck's not great, and that's why I'm seeing him. But he was able to overcome that injury just being very active his whole life. Okay, so prevention, that's our main reason why we're talking about this topic today, and what you can do to maybe avoid being in a physical therapy or having to have surgery. So there are regular exercises you can do to strengthen, stretch, and reduce tension to these muscles, and that should hopefully help you reduce your risk of injury. Very important for those higher risk groups that have to do the overhead work, the heavy lifting, and then as you get older. So maybe even if you like to play paddleball or pickleball or any of those kind of racket sports, these would probably be very good for you. Okay, and there's going to be 4 main groups of exercises we're going to talk about today. The first 2 kind of go hand in hand, kind of exclusively. You'll start with one, progress to the other. The other 2 we would do continuously. So your isometric strengthening. Isometric is a type of muscle contraction where we're going to build some tension without movement. So it's just done in one place. You're not moving through a range of motion. It's a great initial exercise to get you started, but usually we want to advance past that and get into some resistance strengthening. And that would be more like lifting weights, dumbbells. We like to use TheraBands, which I'm going to present in this presentation. So that's kind of what we're looking for there. All right. Stretching and motion, those are exercises we're going to use to keep the muscles loose and to maintain your range of motion. So making sure you have that mobility through. You know, you can do a lot of strengthening, but sometimes the muscle doesn't have pliability, flexibility. You're still going to be limited in how far you can reach. And then posture is very important. It can lead to a lot of strain on your rotator cuff muscles. So we want to make sure we're addressing posture in any prevention program for the rotator cuff. Okay, shoulder isometrics. So the keys we want to do with these isometrics are to push only as hard as is comfortable for you. We want to hold each push that we're doing for as long as is comfortable. And we want to repeat it frequently each day, a number of times. Typical prescription I'll give to people for this is 10 to 20 repetitions for a 5 to 10 second hold. And again, we want to do that daily. Let pain kind of guide you on these, especially if you're kind of new to some of these exercises. You don't want to push too hard or too much and then have a lot of pain flare up on you. Kind of just take it at your pace. Eventually, you want to build that tension up so that you're kind of doing a maximal push, but it's going to take some time to build that up for you. So, and then I have some slides with these pictures on them. We will have a document at the end of this webinar that will have all these exercises on them and will be sent out to the people who registered through Zoom. Okay. So first one I'm showing is flexion. That's going to kind of build the muscles in the front of the shoulder. And again, you're just kind of building up some tension, hold, relax. It's like so, just like the picture showing. Usually I will have somebody use a towel, kind of prevent any damage to the soft tissue and area, especially the areas we're doing here is usually some bony prominences that can kind of irritate you. So use a towel just to avoid any irritation to your tendons. Internal rotation, that's pulling inward, and that's going to get more of that subscapularis muscle that is kind of sitting on the front part of the scapula there. Abduction, that's going to get more of the supraspinatus. This is probably the most common one we encounter of tears. You're lifting out to the side. Extension, that's kind of the back of the shoulder, as well as external rotation. It's going to get those muscles in the back of the rotator cuff. Okay, this will be the back side. So once you get through those, you can do those pretty easily without much pain, discomfort. You can do a maximal hold, maximal push. Then we would progress you to the resistance exercises that are shown here. And these are TheraBand exercises, and I'll do a little demonstration here as well. You could also use dumbbells or soup cans in these same directions. That would be equally effective. I like the band because it does kind of change. It gets tougher as you go throughout that motion. That's why I do prefer those. But again, use what you have available at home. Typical prescription for these would be 2 to 3 sets of 20 repetitions. So you'll do 20 times, take a little break. And usually you want to kind of do a slow controlled motion, which I'll demonstrate. Maybe a little pause at the end too. Now, when you get to these, we don't have to do them daily anymore. We're going to change that to about 2 to 3 times per week. They're not as difficult to do, not as tough on the muscle. So you don't have to do them as frequently. And if you did them every day, possibly could lead to some injury down the road. When you're in therapy, we will do it because we're trying to correct a deficiency, but we're trying to build you slowly with this program. And then the other thing I want to mention for these 2 motions, we're anchoring that band low, usually in a doorway. I'll kind of tie a knot at the end of the TheraBand and anchor it in the doorway. So I'm going to turn this slightly so you can see. I have a band attached to my doorway here. And let's see. Get that reaching up and out, little pause. Back in. Start, and the farther you get away, the more difficult it's going to be. Okay. So that's TheraBand exercise. And that's about the pace you want to do. Nice, slow, controlled motion. Little pause at the end, slow, controlled on the way back in. Okay. So those were kind of the first two that would get more of that supraspinatus muscle. These two will get more of the ones on the front and the back of the rotator cuff. Internal rotation, external rotation. And again, we just move the anchor point up, more about waist level with this. You could also use dumbbells, but you would have to change your position. You would do them in side lying then, because you want gravity to kind of give you that resistance versus the band is giving it to you with the band exercises here. For this internal rotation, you would do laying on the side, lifting up. On the external rotation, you're going to lay on your opposite side that you're doing the exercise on. So that's the strengthening component that we're talking about. Motion. So the first ones I'm showing here are just kind of good warm-up exercises. Let's say you're going to go do your job that day. You want to do a little warm-up before you get going. These would be the ones to go to. First one is just a pendulum swing. You're kind of hanging the arm down, dead weight, and you're kind of starting small, making slowly bigger movements, okay? The shoulder rolls, that's more to move that shoulder blade that all the muscles are attached to. There's other muscles that we're not really talking about, but will also get stretched through this motion with doing the shoulder roll. And then the wall snow angels. Just get up to a wall, trying to stretch out and do some movement up through there. Okay? Usually for these, I would recommend 10 to 20 repetitions before your activity. Okay? Stretches. So another range of motion thing we're addressing with the shoulder. But stretches are usually done after your activity. So maybe after your work day, after you got done playing paddleball, you would work on some of these. And the first one I'm showing is kind of a pectoral stretch in the doorway. Kind of putting your arms up here and you're stepping forward. And we're mainly trying to focus on loosening the front part of your shoulder joint with this exercise. The next one is to stretch the back portion of the shoulder. So you're just reaching and pulling that arm across till a good gentle stretch is felt. For these exercises, we're going to do 3 repetitions for a 30-second hold. So you do 30 seconds, take a little break, shake it out, do it again. So repeat that 3 times. And then finally, this one over here is a lat stretch in the doorway. So lat's kind of a muscle that runs along your back. So more kind of the bottom portion of the shoulder towards the back, and another area that can get tight and limit how far you can reach up. The other thing I wanted to mention is you could also use a tennis ball to loosen your muscles, especially if you get like those real tight trigger points. A lot of times I'll have patients use a tennis ball and kind of locate it in a tight area and either lay on the floor against it, lean up against the wall, and you kind of just hold that tennis ball in place so that muscle starts to relax. And that's another thing we could utilize to kind of keep your mobility going. And then posture. So this is the fourth thing I wanted to address. So in these pictures, it's showing somebody with very poor posture and how they could correct it. I like to point out a forward head compared to the shoulders can cause a lot of neck issues as well. He's kind of rounded in the shoulders here, slumping forward, and then also the back's rounding here. Kind of get that Gallagher hump, they call it. And why this is important is if you're maintaining this posture for a long time, maybe for your desk job, or you're playing a lot of video games or watching too much TV, over time it gets very difficult to get out of that posture. Those muscles will really start to tighten if you don't ever move out of it. So doing the stretches that I've shown and that I'm going to show for postural reasons are going to be good to make sure this doesn't become rigid, and then it becomes really hard to get you out of there. And then he's also demonstrating a real proper posture, with the ear in line with the shoulder, in line with the hip. Almost like sticking the chest out compared to this gentleman over here. And then the one thing I always do this with my patients is I'll have them get into that kind of slumped over posture. You guys can do this as well as you're watching. Kind of get here and then try to reach your arms overhead. And it might feel almost like a little strain trying to do that. If you correct your posture and come up, it'll be a lot easier. And you should notice that I can reach a lot higher as well. And that's mainly just my upper back that I'm correcting there. And I'm not so rounded as well. So some postural exercises you can do. I added this one here where your back is up against the wall. We want to make sure the butt's in contact with the wall, the shoulders, the back of the head. And you're trying to stand up nice and tall and just stretch out. Sometimes I'll have patients do this as well. Maybe if you're getting elderly and you're kind of creeping down there, make a little mark on your wall, maybe in front of a mirror, so that you can make sure you're measuring up to that spot every day to try to maintain your height. So you don't get kind of slumped down as you get older. The next exercise is shoulder blade squeezes. So to reduce that rounding of the shoulders, we'll have you squeeze those shoulder blades back in together, and you're going to hold that exercise usually for about 5 seconds, 10 to 20 repetitions. Chin tuck, that's that forward head posture we're trying to reduce. This is kind of showing her out, pulling that neck back and the ear in line with the shoulder, side of the shoulder here. That's a tough one for a lot of people to kind of grasp. Sometimes I'll have them kind of just nodding forward, which is not correct. We want to be nice and tall, and you're retracting that skin in line, pulling back, and then you're going to hold. Do it to your comfort level again. You know, if you have issues with these, it's not going to feel good right away, but over time you should be able to loosen up and really get that posture to correct. And then the last one down here is like a back extension. And it's again more for your upper back than your lower back. You're reaching arms up over here, really trying to stretch out that upper portion of your back. So again, not so much the lower, but again, to kind of prevent you from humping forward over time and correct that. Okay, so those are the main exercises I wanted to show. Like I said, there will be an opportunity for you to get these if you sign up through Zoom. I think Kate will be sending these out at some point today. And I also wanted to talk about a free 15-minute screening that we offer. This is at all the Renew clinics. Kind of work you into our schedule as time allows. So we do want you to contact us first. Don't just show up at our door. And my contact information will be at the end. You could also go on to our website and gain that contact information for some of the other locations. But when you come in for these screenings, we're going to assess your range of motion, kind of confirm any possible diagnosis we think might be going on, determine if therapy will help you, and also recommend a plan of care for you, and then also help you kind of obtain that physician referral. A lot of times we do still require a physician referral for your insurance to cover therapy. So it kind of helps speed that process along. Another thing, physical therapy often is required before you have any MRI or shoulder surgery. A lot of insurances are now requiring that. So again, this is a way to kind of start that process. Even if we don't think we can help you much, we can help speed it along and get you where you need to be. We also have a slide with all of our locations. We're mainly located in the Tri-City region, but we do have some kind of outliers up in Tawas, Augrey. We do go out east to Caro as well. If you're in Saginaw, Bay City, Midland, we got you pretty well covered with a lot of different locations. So any questions anyone might have, I would love to answer.
Thanks, Casey. That was a lot of great information. We just had one question. Unless anybody wants to submit anything last minute, you can click the Q&A button. We had some people saying hi from Facebook, but we didn't have any questions there. You can type them in the comments on Facebook. But our question was from someone who is a hairdresser, and they asked how they can keep their shoulders strong without getting into bad habits.
Okay. Well, again, a lot of the exercise I presented here, what I find with hairdressers, usually like dental hygienists, dentists as well, they're kind of bent over a lot. So make sure you have a good work setup and you're maintaining that proper posture is going to be key. And again, that will help kind of reduce some of the strain to your shoulders as you're working over time. But yeah, doing those warm ups, stretching afterwards, and then getting some strengthening in there in the week would be very beneficial for somebody in that job.
Thanks. Looks like that's all we have for questions. But as Casey mentioned before, we'll be sending out an email today to everyone who registered on Zoom that'll have a printable of all those exercises he mentioned that you can print off. But other than that, thanks, Casey.
All right, thank you. And then have one more slide here just with my information on it.
Good. Thanks, everybody. Have a good day.
Thanks.